What's up? What's up? What's up? We live at 6, reacting to Donald Trump. He's at the Rural Investment Roundtable discussing healthcare medicine prices. Uh, Let me get over here. Boom, boom. Yeah, they trying to do something about these healthcare prices and medicine prices. Because see, when it comes to Obamacare kind of messed up the monthly prices on healthcare. And for some reason, he's the president. He know more than us. He's saying that once they put the they take the money out of the healthcare providers' hands and give the money directly to the people, that will cause a bargaining for the prices of healthcare every single month, and the healthcare should go back down. That's what he's saying. That it's gonna go back down to normal levels. What is normal levels, Stock Sniper? Well, if you young, shut the door. If you young, wait, no. If you young and you don't really understand what I'm talking about, we're in the 90s, you know, uh, healthcare prices was kind of cheap. Well, when Obama got elected and he came up with this Obamacare, it automatically made healthcare monthly premiums go up every single month. So, like if you got a job, right, and you work and you participate in the in your company's benefits package, well, you're paying a whole lot more these days than what we paid in the 90s, right? If you got a back before Obamacare, if you worked for a particular company and you were there for a certain amount of time and you got a benefits package, you supposed to pay 20. They'll take it out your check. It's supposed to be $20. Well, these days, if you work because of the Obamacare and Affordable Care Act and the money going strictly to these healthcare companies, it automatically made all the premiums and all the monthly premiums go up. So a lot of people that's working regular jobs, depending on how many kids you got, you could be paying $200 and $300 every time you out your check. It like the prices have doubled and tripled. And since because the healthcare subsidies got deleted, right? That's going to make the healthcare monthly payments go up even higher. So appreciate y'all for rocking with me coming off up in here. I think I'm gonna skip the gym tonight. I don't want to do it. I'm gonna skip the gym tonight. I think I might. It just depend on how I feel. But we're going to react right here because I think I'm going to go and do this now instead of wait. If I do decide to go to the gym, I think I'm going to go and do this now instead of doing it when I get back to the gym. It is 6 o'clock right now, so I appreciate y'all for joining me. Hit the like button as you coming in. This is the investment roundtable with Donald Trump discussing not only healthcare prices, but also prescription and medicine prices. So let's go. Appreciate y'all for rocking with me. Let's see what it's about.
No, there isn't. You'll never be able to get them up. You never. I mean, the whole industry is going to be torn apart. I said, we'll get them up easily. Are you crazy? Of course we'll get them up. That's what I do for a living. I get people up. So I started with President Macron of France, and a very nice person. I like him a lot. I hope he's listening because he doesn't believe that, but I do. He's a nice man. And I said, Emmanuel, You've got to do it. 100% you're going to do it. No, Donald, I told you I will not do that. I said, here's the story, Emmanuel. If you don't do it, I'm going to put a 25% tariff on all goods, wine, champagnes, and everything else coming into the United States of America. He said, Donald, I would love to do this for you.
Hey, what's going on,
He'd never
Chad? What's
to do
going
it.
on, ATM
And
Tim?
that's
How
where
you
it
doing?
began. And I went through country after country. Susie was responsible for getting every one of those leaders on the thing. Susie, by the way, stand up, Susie. She is doing such a good job. She's the first female chief of staff, and she might be the best chief of staff too, but she's doing a great job. Thank you, Susie. So Susie got him on, and I just went one after another. I called Germany. No, we will not do that. I said, no, we're going to put a 25% tariff, which is, by the way, about 7 times more than they would have to pay by raising their drug, like 7 times. This wasn't like a little bit more, 7 times more. And I may do that for Greenland.
I think I had the
I may
mute
put a
button
tariff on
on.
countries if they don't go along with Greenland, because we need Greenland for national security. So
I
may
think
do
I
that and give
did.
you a
What's
little-
up, ATM
I'll talk
Tim?
about-
How you doing,
I'll
bro?
take you out of that. In fact, that'll end
I
up
think
being
I
the
had the
story.
mute
But
button
actually,
on.
this is a much bigger story
Appreciate
because we're
everybody for
reducing
joining.
healthcare by numbers that you haven't seen. So I spoke to the top 10 countries. They all said no, and within about 2 minutes, they all agreed. And we were off to the races. And now we have favored nations. It's called most favored nations. So if France is paying, let's say, $20 or $30 instead of $10, we are going to pay that 20 or 30. We pay the lowest price, whatever the lowest price is. So if France is paying $100, but Germany is paying $20, we pay what Germany pays. So we go from a horrible situation on drugs, prescription drugs, to the lowest price anywhere in the world. Is that a correct statement, Oz? Because they're going to blame you. If you want to correct me, you can, but you won't be here for long if you do. They'll
You're
say,
correct, Mr.
Oz has
President.
left employment. No, but is that a correct statement?
That's an absolutely correct statement. And that's what we want to codify in the great healthcare plan.
Yeah.
That's
what
why
we're
it's so important.
codifying. That's
Because if
right.
the president's not here, there's a flight risk with these companies not obliging us anymore, because I think it's the strength of your personality, but also they know they will follow through with the threats if we don't act. So we believe other countries will change their opinions, and so will drug companies. So we've got to get it into legislation.
Well, if you have the wrong president, the countries have tremendous influence over us. They look, why did we go to an income tax system instead of a tariff system? We had the wealthiest nation. If you go back to
Hey, what's
the
up, Tony?
1800s, 1887, we had money, so much money we didn't know what to do with it. But the countries at that time, same, no different. They have a tremendous influence over this country for whatever reason, I don't know, but they do. So if you have the wrong president, they'll change the system in 2 minutes. I mean, they'll change it. And the drug companies are very powerful, too. You have to deal with them. In this case, it was both. I mean, you had a problem with the drug companies, but you had a tougher problem in theory, other than the fact that I
They
understand
bought
how to deal with them.
5950.
I'm the
What is
tariff
this
king,
channel
and the
about?
tariff king has done a great job, and I hope we
channel
win
is
the
about
Supreme
me.
Court case, because if we don't,
That's what it's
it's a
about.
shame for our country.
It's about my
We
life,
have
what
a
I like,
great, safe,
what
beautiful
I'm
country
interested
now.
in.
We're doing better
If
than
you're
we've ever
interested in
done.
the
We
same
hit
thing,
42
we
stock
like-minded
market highs
people,
during the 11-month
and the
period
channel
that
is
I've been
about
here.
you, too.
There's never been anything like it. Stock market hitting a new high again today. So it's it's been incredible. So just to end it on this, because it's such a big subject and it can't be explained by
you like
reading
the stock market.
as good as my
If you
speechwriter
like
is. He's
to know what's
fantastic,
going on
but
in
he can't write
America
it in one
and around
sentence
the
what we're
world.
talking about. So we're
like
going to get
exercise.
most favored nations. We will be
If you like
taking
positivity.
prescription drugs down to levels never
you
even
like inspiring
contemplated.
people.
And that's all great for
And
healthcare.
then this channel is
because
about you, too.
when you're paying a tiny fraction
You the
of
same
what you
stock
had
sniper on
anticipated
Webull?
paying prior to today,
Probably
prior
so.
to this month. This
Be
all
on
took place
there.
over the last month and a half. And the sad part is that when we first announced it, and we did it in a little bit more general form, when we first announced it, the Times did a story on page 22 or something, way back in the little story in the back of the newspaper. This is the biggest revolution in the history of medicine in this country because it's price. You're going to buy the drugs for a small fraction of what you were paying for them last month. And I tell the story of my first term. I was the one, after 28 years, that got drug prices down. It was either 1/4 or 1/8 of 1%. I got them down for the year. First time in 28 years. I was so proud of myself, I called a news conference. I said, ladies and gentlemen, for the first time in 28 years, drug prices have gone down for the year. 1/8 of a point. In fact, I had a chart. It was the worst chart I've ever seen. It was a line that went from January to December, and it was dead straight. You had to get a little, like a carpenter uses to
on ears.
This doesn't look
You
good.
look at
It's
my
not the
profile
greatest line.
picture.
But I was proud of
That's
it
the
because
same
it
picture
did.
you
It
see
went
on
down either 1/4 of
Webull,
a point or an eighth of
that's
a
me.
point, tiny. And now think of what we're doing. We're bringing medicine down by many times. Nobody's ever seen. And there are
But
two
on
ways of
Webull,
calculating. You could say
Leon,
1,000%, 2,000,
I don't
or
really,
you could say 90%.
Webull is a lot of different
80%.
things.
The Democrats
I only
want you to
use
say 90
Webull
or
for
80, but
trading
there are
and
two
day
ways of
trading.
calculating it.
I
You
don't really
understand
be in
that,
the
Dan.
community
And
on Webull.
we'll take either way, it doesn't matter. But we'll be paying a tiny fraction. So that's going to go into our plan. And what Oz said is very important. It's very important that whoever is in this office is, strong and intelligent. And if they're not, they could, it could be ended. But what we want to do is we want to have it codified, so it's very hard to change. And that's all part of the process. I think it's the greatest revolution because it's financial is, a big part of the drugs. And all of the doctors sitting there know exactly what I'm talking about. They have their patients in Europe and they're saying, I can't believe it. I'm buying the same thing for, 15% of what I pay in New York or in Chicago. And they're all nodding their heads. That's right. That's not going to happen anymore. We pay now, just to end it, the lowest price in the world, whatever that is, that's what the United States of America will be paying. Isn't that an amazing, long story? I was going to say long, boring. It's not boring. To me, it's long and exciting. It's the biggest thing to happen to healthcare. I don't think there's anything we can do. We can do all of our different methods, but there's nothing we can do that can ever top what we do. And the press should treat it fairly instead of not writing about it, because they don't write about it because it's me. Primarily because it's me, but also because it's Republican. And they don't write about it, and they should be ashamed. But fortunately, the public understands it, and that's why we won the election in a landslide.
Leo, Trump is so stupid with his lies.
Instead of Americans
What did he
paying
lie
the
about?
highest drug prices anywhere in the world by far, by 10 times.
You're going to make a comment like that?
Will now pay the lowest cost.
You should
paid
tell
by
us what he
the
lied
lowest
about.
nation. So the lowest nation, whatever that is, I hope they negotiate a great deal. I hope somebody out there of all those nations is going to be a better negotiator than everybody else. And whatever they get, we get, Mike. Is that pretty good? Look at Mike. Even Laura, first time I've ever seen him smile. And next, our plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending the money directly to the people. So instead of, and this started,
some of those comments come.
and I'm not really a healthcare maven, but I was always a good businessman. It started, I'm reading the paper and I see the money that the insurance companies were
Like I be
making
saying
from
on my
us
live,
on
YouTube is
Obamacare.
changing.
And
All
they're
that,
up by 1,000%,
cussing and
16, I think one
trying
was
to
up
stop that.
1,723%. 1,700%.
But if somebody's not
And
really
it's
on the
because
streaming
of the
service,
massive amount of money
they're
that's
not
sent
seeing that.
to them by the United States
lot of
government.
comments
And I
are
said,
being
why don't
banned
we
by
just send it
negative stuff
directly
that
to
they
the
say.
people instead? And I made that statement. It was
He
a
said
common sense
Trump is so
statement. I
stupid
didn't
with
check
his
with
lies.
anybody. I didn't even call Oz or anybody. It just made
Blocked
sense. I made a statement, and it went viral. Can you believe it? It was so popular. In other words, we cut out the insurance companies. They're making a fortune. And, they're good people. They're business people. I don't blame them. But we cut them out. We pay the money directly to the people. The people love it. I said it, I said it as a non-professional in that business. And I made the statement like all of a sudden it's like the biggest story, that one, the biggest story. And I get a call from Caroline, who's around here someplace. She said, sir, we're getting inundated. Margot called me too. Margot, you called me too. Margot, everyone knows Margot. She's been here from the beginning. right from the beginning. But she said, sir, both of them. They said, sir, we're being inundated by what? You made a statement about health care being paid directly to the people into health savings accounts or whatever you want, health care accounts. And I said, I did. What's the story? He said,
2-year
it's
Pakistani.
it's crazy. It's blown up.
Forget.
People loved it. And
Shout out to
that's where we
Dagestan.
started. So Obamacare was
If
designed
y'all don't
to
know
make
what
insurance
Dagestan
companies
is, that's
rich.
in Russia.
It really was. I mean, maybe not knowingly
Shout out
at the
to
time by
Khabib.
Obama, because he didn't know
Make
much
a mid
about this
off.
stuff. That was designed by other people in Congress
Shout
that
out
are
to
total
Russia.
pros
Shout
that are
out
bought
to
off by the
Dagestan.
insurance companies. And the problem we'll have with this is we'll get no Democrat votes, even though it should be very bad for them if they don't. But maybe you'll get some. You'll call some
Shout
of
out
your
to
friends,
Umar
fellas,
making
and
that off. Who
Bob,
gonna be
you'll call some
fighting
of your friends over
next
on the other side. I
weekend
don't know how they can reject it.
when
It's
the
just
UFC
so
will be
popular. It's so
free
compelling. So
on
Obamacare
Paramount
was designed
Plus.
to make insurance companies rich with taxpayer subsidies, and I want that
Shout out
extra
to all my
money straight to
Pakistan,
the
all my
health
Dagestan
savings
brothers.
accounts for you. And you can choose your own health care. You go out and negotiate your own health care. It makes people entrepreneurs, mini entrepreneurs. They'll
Shout
pick
out to
the
all the
health care
Sambo
that's best for
wrestlers
them
out
because
there.
it's so different. A
Yeah,
young
shout out to
person, they
Islam
need
too.
health care for different reasons, and an old
Shout
person
out to
doesn't need
all
certain things that a
my
young person
Sambo
needs, and vice
wrestlers,
versa.
brothers out there in Russia.
To further reduce insurance premiums, my plan ends the
that's,
giant kickbacks to insurance
another
brokers
Pakistani
and corporate
MMA
middlemen. We're
fighter.
getting rid of the middlemen. How long have you heard doctors, all these doctors over there, look so smart. They're all brilliant people. I assume you're brilliant, otherwise you wouldn't be here, right? I assume we have the best. Do we have the best of the doctors? I would imagine, right? Hey, how cool is the White House? Okay? They're always in operating rooms. I wouldn't want to be in an I don't like operating rooms, but they do. But how cool is the White House, right? The coolest place on earth. And this is where it all begins. This is where we came up with a little concept about a place called Venezuela. How did that work out? And this is going to be the same thing in terms of its precision. Its importance is so big, it's going to work just like that. Venezuela was so amazing, but I equate that to other things because we can do other things like that. It doesn't always have to be a Minnesota where everything is corrupt, where they have healthcare centers that nobody shows up and somebody's making millions of dollars, where they have daycare centers where there are no kids. It's a scam. It's a big scam. It's like
Dang.
a horrible thing. We have a country that was great. We have
Y'all
a
already
country that's now
said
great again. It's really coming.
they got daycare centers out there that's scamming the healthcare centers. They got daycares that's not even open. That's what he just said. I gotta rewind that. That's what he's saying.
Pick the health care that's best for them because it's so different. A young person, they need health care for different reasons, and an old person doesn't need certain things that a young person needs, and vice versa. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen. We're getting rid of the middlemen. How long have you heard doctors, all these doctors over there, look so smart. They're all brilliant people. I assume you're brilliant, otherwise you wouldn't be here, right? I assume we have the best. Do we have the best of the doctors? I would imagine, right? Hey, how cool is the White House? Okay? They're always in operating rooms. I wouldn't want to be in an I don't like operating rooms, but they do. But how cool is the White House, right? The coolest place on earth. And this is where it all begins. This is where we came up with a little concept about a place called Venezuela. How did that work out? And this is going to be the same thing in terms of its precision. Its importance is so big, it's going to work just like that. Venezuela was so amazing, but I equate that to other things because we can do other things like that. It doesn't always have to be a Minnesota where everything is corrupt, where they have healthcare centers that nobody shows up and somebody's making millions of dollars, where they have daycare centers where there are no kids. It's a scam. It's a big scam. It's like a horrible thing. We have
Just
a country
imagine,
that
Chad.
was great. We have a country.
Just imagine if you go to the doctor, you go to the healthcare center, and nobody's there. That's a cold piece of work to have the U.S. government and our taxpayer money being sent to these healthcare facilities, and it's a scam, and nobody's there. Big money scam.
that's now great again. It's really come a long way. Make America Great Again is almost going to be obsolete because our country is very close to, we were going to keep America great. We may have to switch to keep America great, but I don't know. There's something about MAGA we should never change it. Susie said, "Don't change." We like MAGA. Everybody likes MAGA. So we want to make this precision, just like a Venezuela, just like the attack on the Iran nuclear weapons, which wiped that out, just like all of the other things we do, they're precision. We want to make it the opposite of Minnesota, California, and all these places that are so badly run. So to further reduce insurance premiums, my plan ends the giant kickbacks to those insurance.
Yeah, Emmett, all of them lie and exaggerate. You know what I'm saying? That's what they do. They lie and exaggerate. I've never heard that. So if I hear about it or see it in real life, then that's when I kind of believe it. Or if he said, and then next thing you know, we find out later, then yeah, but majority of these politicians on both sides, majority of them lie, steal, cheat, you know what I'm saying, and exaggerate, to get their agenda across, to get a vote, or whatever the case may be.
Insurance brokers and corporate middlemen that you've been hearing about for so long. It also funds the so-called cost-sharing reduction program to bring down the cost of the most common plans on the exchanges by more than 15%. And next, the great health care plan mandates unprecedented accountability and transparency from insurance companies and all health care providers. We want transparency. You're not allowed to ask a doctor how much is it going to cost. You're going to have your heart ripped out, and you're not allowed to negotiate. This is a giant scam. It's, in certain ways, look, nothing can compare to most favored nations. But when you give yourself the right to negotiate, you're not allowed to even ask how much it costs. You're supposed to go into a hospital and get operated on. Then they send you a bill and you have to file for bankruptcy. I'm not going to let that happen. So we're going to have insurance companies and healthcare providers going to have great, and hospitals, great transparency. The word transparency is a very important word. So they can't get away with ripping you off any longer. It requires insurance companies to make it easy for you to compare plans. You got to be able to compare plans. You can't do that now. You're not allowed to do that. It's not even believable. I tell you what, I used to sit before I was a politician home, and I used to say, how is that possible? Things happen that, I guess it's just the forces of nature, the forces of power.
But what I'm thinking about, Chad, he's saying that they're going to, because see, if you an older person, you know exactly what I'm talking. You know exactly what I'm talking about. Before Obamacare came about, health insurance was really, really cheap. If you had health insurance through your place of work, through your health benefit package, a lot of people were paying $20 a month, $30 a month, $35 a month. This was before Obamacare, way before then, and once Obamacare came, it made all the health care, it made all the monthly prices on the health care go sky high. But what he's saying is that the money that they're using for Obamacare, that they're not going to give it straight to the insurance companies. They're going to give it straight to the people. And he said, with that being said, that should make the monthly prices on health insurance go back down to what it used to be. I've been trying to comprehend and think, how would that, how would it do that? Yesterday's prices, guys, chat, it's not today's prices. I don't think, I might be wrong, but I don't think those healthcare premiums are going to go down that far. I think they might go down a little bit, but I don't think they're going to go down that much. That's just my opinion. That's just what I think. I hope so. Just like a lot of people think that because of this Venezuela stuff and this oil and all this, they're thinking that gas gonna go back down to $1. Now I haven't seen gas $1 a gallon since I was about 20 years old. So we're going to see what's going to happen the next year and a half to 2 years. I would be amazed if gas go back down to $1 and these healthcare prices, these monthly fees, go back down to $100, go back down to 30, 35. It's going to be hard to see.
And you end up with very, very badly treated people, and they won't stand for it. But these forces are going to release an earthquake of reduced price health care. You're going to have massively reduced costs. This is no longer we're going to cut it by the famous 1/8 of a point. You're going to have massively reduced health care, and it's going to be massively better.
See, saying it now.
Great health care at a much lower price, which is the two things. We want great health care and we want low price. You're going to have great health care at low price. Now you have terrible health care at a high price. You have horrible, horrible Obamacare health care. Like everything else he did, it was crap. It was a horrible plan. It was from day one, and it should have never been approved. It was a very sad night that night when there was a thumb raised. Most importantly, will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices. You're going to post your prices at their place of business. Something they don't have to do, something they're not even allowed to do. We'll have the maximum price transparency, and the cost will come down just by that, not even talking about favored nations. The price will come down. So just in conclusion, I'm calling on Congress to pass this framework into law so that we can get immediate relief to the American people, including rural America. And I hope to get Democrat votes. They know, they saw it. I know a lot of Democrats. And they say that plan is unbelievable. Are you going to vote? Well, I'm going to try. They have tremendous pressure on them. Vote no. Vote no. We have a couple of Republicans. Thomas Massey always votes no. He's like, something wrong with the guy. If you have any clinical psychiatrists in there, maybe go check out his mind. But he always votes no. He's a very bad person. He's a very bad Republican, bad American when you always vote no. Just vote no. Do you approve? No. You know, there's not a thing you can say to him either, Lola. Look, Lola wants to be nice. He likes to get along with everybody. I don't. But they vote no. But so I don't know. You know, you have some people, they're very, I call him Rand Paul Jr. Rand Paul always votes. I don't know why he votes no, but I guess he thinks it's good politics. I got him elected twice. If I didn't endorse him, he wouldn't have been elected. But he doesn't reciprocate, and I guess that's okay. But I want to hear now, if I could, from Dr. Oz, and then we're going to have Dan Sullivan say a few words, and Rob and Mike, and Governor, you're going to say a few words, and we appreciate you being here very much. You're doing a fantastic job. I just want to leave by saying that this is the biggest thing to ever happen to healthcare in our country. It will not be covered that way by the fake news, and that's a sad thing. It will probably not be voted positively by the Democrats, and that's a sad thing. They all know how good it is. I think we can make health care into a Republican issue because the Republicans are going to be close to unanimous on this. It should be unanimous. Maybe we will be unanimous, but it'll be close. But we have a small majority. We probably need a little bit of help from the Democrats. So whatever we can do, we're going to do it. It's the biggest thing to happen to health care, maybe from the beginning. So, Oz, would you take it away, please? Thank you very much.
Mr. President.
I'm thinking that, chat, if they don't get this done again by January 30th, which it's a lot going on right now, so nobody's talking about shutdowns again. I'm thinking that if they don't get this passed, if they don't get this done, it's going to be another shutdown come January 30th. So even though we haven't been thinking about shutdowns and all that stuff, it's still 2 weeks. If I can remember correctly, they got until January 30th, or it's going to be another shutdown if they don't get this done. If I remember correctly, I think that's what it is.
Mr. President, thank you for standing up for American health care. And I just want to underline this fundamentally important issue. We need Congress to help craft the Great America Health Care Plan. And the Great Health Care Plan will work. It's a brilliantly conceived framework. And as it comes to the American people, they understand that they'll want it. And it should represent the analogous situation, similar to what you did so brilliantly last spring with the Working Families Tax Cut legislation that the President mentioned, has created the Rural Health Transformation Fund, which is why we're here today. I want to put a little bit of texture around why this is such an important issue, because the Rural Health Transformation Fund is the largest investment ever in American history in our rural communities. Yeah. 50% increase in the amount of money that Medicaid, which Secretary Kennedy and I regulate, into our rural communities, $50 billion. You can do the math, it's $1 billion per state, and that's an important factor because it got them competing. There are 60 million rural Americans, and these folks do not have access to the same care that's available in urban and suburban America. Their life expectancy, if they're in a vulnerable situation, is 9 years shorter, because your zip code actually is your destiny. It determines how long you're going to live, and we can make a dent in this because the high rates of chronic disease and other ailments that plague our rural areas are often driven because they don't have access to care. That's going to change because of the Sentinel legislation. And again, it's similar teams, the same leadership, same president, same Congress that passed the Working Families Tax Cut legislation, which is incredibly popular around the country and will make the great health care plan successful as well. From the day the legislation was signed to create this wonderful fund, this transformational fund, the team at CMS, which is under Secretary Kennedy, began working. And they're here today. Steph Carlton, outstanding Chief of Staff, Alina Chekai, and Emily Chan. That day started working. It was July the 4th, by the way, on the specific vision for the program. How do you actually get the money out the door in 6 months? The president was insistent, did not want the money in Washington. So we began working closely to make sure that we'd use the money not as a Band-Aid, but to empower those closest to the challenges that rural patients face. And who are those people, the 50 people who know rural health care the best? The governors. They wanted the money out of Washington into the governor's hands, and that was done in a remarkable way. The governors thought big. We have one here from Nebraska who's actually the first to start working on community engagement, which is part of that legislation as well. But we have to right-size health care in rural America, and that's an important phrase. All 50 states submitted amazing ideas to transform rural health care in ways that should have been done decades ago. The CMS team awarded each team their portion of the $50 billion investment precisely with the same precision that we took Venezuela leadership, convicted individual, and with Iran as well, the same precision on time before the end of the year, and got it out of Washington into the states. Now I want to take a step back and do a little thought experiment, Mr. President, if you want to do this. If you, and God forbid this happened, had turned your head the other way in Butler, Pennsylvania, it wouldn't have been an ear injury. Now, I've been to Butler. I'm from Pennsylvania. Butler General Hospital is a good hospital. They don't have neurosurgery there. If you have an injury to the head, you have a golden hour to get cared for. You were taken to Butler General Hospital. Because the injury, thankfully, was not as lethal as it was designed to be, it wasn't a problem. But if you'd had a head injury, you could have had your life saved. But without a neurosurgeon, and there is no neurosurgeon at Butler General Hospital, unfortunately, you wouldn't have an option because Pittsburgh is a far, far ride away. That's the closest metropolitan area where there are lots of neurosurgeons. But with this bill, this legislation rather, this funding of $50 billion, Pennsylvania got its share, and they're going to be able to build telemedicine hookups, even robotic surgery, that would allow an injured individual in a car accident or
hello, David, how you doing?
In Butler General and rural hospitals across the country to be able to access the best care our nation has to offer, so rural America will not suffer. That's the promise of what this money offers to our nation. It's not just paying the bills, not just picking up the pieces. It's actually transforming, using technology we have widely available in urban America, the way we save lives in rural America. Each state competed aggressively because for $1 billion, Mr. President, you'll fight pretty hard. And they gave us brilliant ideas that they're talking with each other about. So we're actually creating teams that now across state lines will connect because they're all Americans and they base their advances on several pillars. Secretary Kennedy can talk about MAHA because there's MAHA elements to this as well, but very precisely sustainable access. We asked states, how can we bring top care closer, like in the thought experiment I gave you for Butler General. In Pennsylvania and North Carolina, there are regional spoke models, and hub and spoke means you've got a big hospital in the city and they adopt or work closely with some rural hospitals to solve the challenges of fragmented care. And that actually works. You share administrative back office work, you group purchase your stuff, you save money, you exchange medical records. Alabama has no OBGYNs in many of their counties. So they're doing something pretty cool. They're actually having robots do ultrasounds on these pregnant moms. So we can actually get those images back to the big center. So we know if the child has a problem and we know if that mother's at risk. We have one of the highest maternal mortality rates in the world, in the country with the best medicine in the world. It's often stated, people ask, does healthcare stink in America? Well, they don't like it. Would you leave America to get healthcare elsewhere? Nobody leaves. We have the best healthcare if you can get to it. We don't want rural America left behind anymore. As an aside, by the way, we've talked about the most favored nation drug pricing. One of the first companies and areas we used most favored nation drug pricing is fertility drugs. That's why we're going to have so many Trump babies, because we've dropped dramatically the most expensive part of the fertility space. And so America no longer will pay so many times more, in that case it was 10 times more, for the same fertility drugs that they're available for moms who want to get pregnant in Europe. I want to thank Terry, who's here as a nurse practitioner, Andrew, who's a doctor, West Virginia, New Mexico. They're representatives of the workforce in rural America. But there are only 2 of them here representative because we don't have enough people working in rural America. It's a big challenge. So Delaware is creating its own medical school, their first ever medical school in a rural.
This seems a pretty good idea, Chad. They're talking about having hospitals like in small towns, like in Texas where I'm at. Some of these small towns got to travel 20, 30 minutes to get to a hospital. You know what I'm saying? If they need something major done, they got to go 20 miles, 20 minutes, 30 minutes. Some towns got to travel an hour because they don't have the proper medical facilities in those little small towns.
Rural part of the state. So that can get more local talent that will stay local in those parts of Delaware. Michigan is launching the high school to healthcare pipeline grant program. They want to take kids out of high school in Michigan, local rural communities, and get them into the system, get them trained as nurses, because they'll stay home because they're from those communities and they'll save lives for decades there. These are the types of programs that can get our rural communities and economies up to high gear and keep it that way long after this 5-year funding is done. And finally, tech innovation. Rural communities would benefit the most from high-tech advances, like we just discussed, as possibly if there was a head trauma case. Many states want to partner with our CMS data interoperability network. It was created by Amy Gleason, who spearheaded so much of the technology transformation in our government. It's going to support the president's pledge to provide transparency that he mentioned as part of the great health care plan. And Congress can ensure these are all available for decades to come if we can get this legislation through. As in the tech innovation forefront, just to give you a couple examples, Texas and Hawaii are making targeted investments in statewide telehealth, so everybody has telehealth. The best doctors for the best knowledge available where you are. We'll meet you where you are. If you're a vet and depressed and you're thinking of taking your life, we'll be there. Just let us know you're in trouble and we'll help. Alaska wants to deploy, and I'm going to hand it to Senator Sullivan in a second, wants to deploy unmanned pharmaceutical distribution kiosks and drones that will deliver medications, because in the North Slope of Alaska, you can't get there this time of year. So these technologies, they exist. Why are we using them in Midtown Manhattan? We should use them in rural Alaska. This administration is committed to collaborating with all 50 states, all 50, red and blue, all 50 states to carry out bold plans to tackle the challenges that local communities face. We're not pouring funds blindly, however, into a broken system. We're going to carefully, precisely, as the president said, target this investment. With healthcare fund running rampant, and I was in Minnesota this week, Mr. President, it's worse than we've heard. But Minnesota, pardon the pun, is just the tip of the iceberg. California is the varsity team when it comes to fraud, waste, and abuse. We're not going to let that happen. We want transparency for this $50 billion investment. We owe it to Capitol Hill. We owe it to this president, and we want accountability to be a top priority. For that reason, we've created an Office of Rural Health Transformation at CMS for long-term oversight. The office, led by Alina, check guide Alina again, was one of the people who helped create this program in the forefront, will guide, she was in the first administration, Mr. President. She's going to guide states in implementing their rural health transformation plans, coordinate all the federal and state partnerships, making sure there's appropriate oversight. In addition, every single state is going to have a dedicated project officer. We will be there with you. We're going to help you. Please engage us. You've got lots of lives at risk. It's a true state-federal partnership, unbelievable, extraordinary milestone for healthcare. Your zip code will no longer dictate whether you have excellent healthcare. Your zip code will no longer be your destiny. It's not going to dictate your life expectancy. Mr. President, I cannot thank you enough for the leadership that it took to get this $50 billion investment in rural healthcare. They don't make a lot of noise. They just want to get the job done. You stood up for them in Congress. God bless you for making this possible. Please do it again. Please do it again for the great health care plan. Let me hand it to Dan Sullivan, who's a spectacular member of the Senate, and obviously Alaska, they're pretty rural.
Thank you, Dr. Oz. And Mr. President, I am very honored to be here. This is a really exciting day. I want to thank you, sir, and your team. Worked really closely with Dr. Oz, Secretary Kennedy, many others. You know, this is a great example of how Congress, working closely with your administration, can achieve historic things. This is historic for our rural health care, certainly in the Working Families Tax Cuts Act. You combine it with what you were talking about, sir, in terms of drug price reductions for all Americans. So these are two things that are happening right now and are historic, and I agree 100% with you, Mr. President. Hasn't got a lot of press, even though it is historic. It's going to really impact people in rural America, especially my state, this fund that I want to talk about. But what you've done on the drug pricing is even...
Ben, will you get Lisa Murkowski to vote for it?
She voted for it.
No, are you going to get her to vote for the great, big, beautiful health care bill that we're doing?
When we get that, I think MFN drug pricing, I bet every
big,
member
beautiful
of
health
Congress
care
Are you
bill.
going to get her to vote for it?
We'll work on it, sir.
Oh, he didn't like that.
We'll work on it.
He got upset, Chad.
So let me actually talk a little bit about the context of what's going on in Alaska and how this relates to it. You know, after 4 years of being locked up and shut down by the previous administration, we are on the cusp of achieving some huge goals in my state that we've been working on for decades.
What's up, Chad? Appreciate y'all for joining. We got 39 people in the building. Thank y'all for coming through. We got 14 likes. Can we get the likes up to close to 40? They're talking about health care, premiums going down, talking about medicine prescription drug prices going down, talking about investing in rural areas so they'll have hospitals. If you live in the country town, you know what I'm saying? If you're in Texas and you live in Navasota, you live in Dayton, you know what I'm saying? You live in Ames, you live in Liberty, you live in all these small towns where you got to go 20 minutes and 30 minutes to get advanced health care. They're talking about investing and putting these hospitals in those little small towns and whatever state you in. I'm just speaking about my state. You know what I'm saying? So hit the like button. You know, healthcare. He's saying that the healthcare premiums are going to get cheaper. If you got a job and you participating in your healthcare plan on your job, which is called the benefits plan, you know, those prices, in his opinion, are going back to where they were in the 90s. So we're going to see how it's going to work. If you like that, hit the like button. Hit the like button. Let's get the likes up. All you got to do is double tap that screen. That's all you got to do.
We have this huge resource development boom going on the North Slope of Alaska. I was with a bunch of the Inupiat Alaska Native people who live up there. They are so excited about what's happening there. We are, as you know, Mr. President, building icebreakers. We're home porting some of those in Alaska. We have huge historic infrastructure and economic and national security investments happening. In particular, the gas line that you have championed so much, the big LNG project. All of these things are happening. It's really exciting. By the way, all of these issues I just talked about, all of those were in the Working Families Tax Cuts Act. So there's a lot of excitement. But, Mr. President, in addition to a strong economy, the thousands of jobs that these projects are going to have, we have to have a strong healthcare system in every state. In rural Alaska, as you mentioned, as Dr. Oz mentioned, has often, almost always been an afterthought when it comes to investing in healthcare in America. And that's not happening anymore after the Working Families Tax Cuts Act. As you said, Mr. President, as Dr. Oz said, this is the biggest investment in rural healthcare in American history. $50 billion. The award the great state of Alaska was able to get working with Dr. Oz, and the parameters of the bill was about $1.4 billion over 5 years to transform our healthcare system. So that's really exciting, but here's the big deal. This is not just about money. This bill isn't just about money. The reason it's so impactful is that it's focused on letting states and governors design the system that they need. Alaska has many unique healthcare challenges, Mr. President, as you know, but for decades, the mentality in Washington, D.C. is this approach to one size fits all. D.C. tells every state, here's how you have to do it, and it never works. It never works. It certainly doesn't work in my state. I'll just give you one example, the federal match on Medicaid. Our state typically has the lowest match in the country, even though we have the highest health care costs and highest delivery costs in the country. The one-size-fits-all doesn't work. This bill is different. This bill that we wrote with your administration is all about allowing states to design a system that works for them with CMS guidance. And this will be a generational opportunity for every state to bring health care closer to home, to make it more responsive to the people who live in that state, and make it more affordable. I'll just end with this, Mr. President. Like I said, a lot of excitement. We got Governor Dunleavy, who sends his greetings, was hosting the stakeholders in Alaska who are going to be applying for these funds, working with CMS in our state. Over the last couple of days, we have over 300 people coming to these meetings on how to use this transformation fund to better health care in Alaska. And this is going to help my constituents, it's going to help every American, and it is really exciting. And I want to thank, again, you, Mr. President, and your team.
Thank you, Dan.
Thank you very much.
He makes chaos.
Thank you very much. We're going to have to go very fast. We're going to have to go we are way behind schedule, and I have a couple of meetings that are very important. Nothing more important than this, but let's go. Come on,
Appreciate
Bob.
you for joining, Jenny. Appreciate your comment.
Please.
Mr. President, thank you very much for having me here today. And I represent northeastern Pennsylvania. Your governor from Scranton, Pennsylvania, so never had the opportunity to meet. But I inherited a very similar problem. But before I was even sworn into office, I had two hospitals, Moses Taylor and Regional in Scranton, that were eminently facing closure. Right. And it's been, and working with Dr. Oz, Administrator Oz, and the CMS team has been absolutely incredible on so many levels. And thank you again for intervening and shepherding us through that process.
Well,
but
you got your own opinion.
Pennsylvania, we're going to receive over $193 million in 5 years. It'll be over $1 billion for the Commonwealth of Pennsylvania. And when you think about northeastern Pennsylvania, clinics and regional hospitals, rural hospitals are the backbones of our communities.
Trump is the GOAT.
Making a targeted investment that is not just going to be a Band-Aid over poor operational procedures. It's going to actually transform rural health care. That's what we are so excited about. Pike County in my district is the largest growing county in the Commonwealth of Pennsylvania where there's not a hospital. The nearest commute to a hospital is over 55 minutes away. So these are going to be funds that will be so imperative. The unprecedented investment is going to be incredible, and thank you for having me up here and being a part of this journey.
Thank you, Rob. Appreciate it.
Thank you, Mr. President. This is a great opportunity to be here with you and your team. Dr. Oz has been a tremendous asset. The $50 billion commitment to rural health transformation is critical. New York State is going to see about $212 million in the first year, which is vital.
I think he's upset,
for
Michael.
Workforce development, access to
He asked
care,
that
primary,
man,
behavioral, maternal, emergency,
if somebody was on board,
telemedicine, et cetera.
and I think the man said no.
How are we
And
able
he's been
to do
having
it?
a frown on his
Because we
face
rooted
ever
out
since
waste,
then.
fraud, and abuse.
He
in the
upset
system.
right now.
Democrats will just say we cut $1 trillion in Medicaid. That's not what we did. We said you need to be eligible. You need to be a citizen. You need to work if you are able-bodied without dependent children. We reined in the provider tax and state-directed payments, which have exploded over years. And we are taking this money, not only preserving Medicaid for the IDD community, our seniors, our children, our single mothers, but we're investing it in rural health. When you look at Obamacare, health insurance premiums have risen 96% since Obamacare took effect. Insurance revenues up 2,000%. Mr. President, you are 1,000% correct that the insurance companies are the problem. They wrote Obamacare. It's to their benefit, and the American people are being screwed. And so we can get a bipartisan agreement on what you are trying to do. When it comes to lowering drug prices, I will tell you, one of the largest pharmaceutical companies is in my district in Westchester County. I met with them in 2024, and I said, what would you do to lower drug prices? And the response was, go after the European price controls. You are spot on taking on the price controls that have been put in place. Most favored nation is the single best thing we can do to lower prescription drug prices here in America. The pharmaceutical companies will tell you that privately. And that is the fundamental fact. We need to go after PBM reform. Associated health care plans, we put that on the floor. Every Democrat voted against it, every Republican for it. Those would reduce costs by 11% because businesses, small businesses, would be able to pool together and purchase health care plans at a lower rate. We need to go after the PBMs and make sure that insurance companies are not owning providers.
See, Chat, I be talking about all the time that when we listen to these people, if you don't know and you don't know nobody that know, sometimes it's good to ask Google. So I asked Google, did insurance companies write Obamacare? Yes. So the Obamacare was put together by the insurance companies. The guy was correct. That's not good.
You have done to lower IVF costs on the drugs is critical, and you are 1,000% correct on expanding HSAs. I fundamentally believe that we can address the issues with Obamacare, make sure that the American people have access to care at a lower rate. We can get a bipartisan agreement to address the EPTC with expansion of HSAs so that the money goes to the people and not the insurance companies. We are committed to working to get this done, and I thank you for your leadership.
Thank you, Mike. Thank you.
Mr. President, gigantic thank you, and thank you for your incredible leadership. Your courage gives me more courage to say it
That's
the way it is.
big business right there.
We're working very hard in Nebraska to run
the
government like a
insurance
business.
companies are the ones that wrote
This investment into rural America,
bill
which,
for
by the
Obamacare.
way, in all of Nebraska, you pull 85%. I don't know what the hell's wrong with the other 15, but you're
Major money
85 is a
grab.
pretty good number. I think, be very, very brief. This plan will allow us to do common sense, pragmatic investments in rural Nebraska, and they will be sustainable. We will make sure that we don't need another dollar after 5 years. We are working on simple things like food. Real food is good medicine. We're working on making sure that all of our veterans, Nebraska is 500 miles long, 250 miles wide, no longer are veterans going to have to drive to Omaha to get care. We're going to take care of our veterans at home. Investments in technology so we can educate our children in rural Nebraska to provide health care are really, really important issues. And I think that the other is we've developed what we call 6 Regions, 1 Nebraska, and that will focus and take advantage of those. So we're working on what we have and then being able to use these resources to also help us with mental health and drug care as well. So we're incredibly grateful. Nebraska, we work hard. We're about faith, family, hard work, the American dream, and we don't ask for much help in rural Nebraska. So we're really grateful for this investment. Thank you.
Thank you.
Thank you.
Thank you for being here. 1 minute.
How about 30 seconds? How about 30 seconds, sir? As a small town kid from Glen Rose, Texas, population 1,200 where I grew up, what you are doing today changes everything. And on behalf of our farmers and our ranchers in rural America, it is a new day and we're so grateful. The final thing I'll say is I think about Abraham Lincoln, who also sat in this room, and I think about other presidents throughout American history. And you think about how the fundamental course of American history has changed in certain pivot points throughout history. I think about you as the peace president, 8 wars solved, more coming. I think about you as the security president, a border that is secure for the first time and more than any time in American history. I think about you as the prosperity president. We talk about, Kevin, wages going up.
We'll give her
poverty
more
coming
than
down.
1 minute.
Oh no, I'm almost done.
She
I'm
can,
almost
no,
done.
she can speak as long as she wants.
Y'all see how he is, Chad?
The prosperity president and what's happening.
kissed the
Think about
ring?
you as the affordability
Look at he back smiling
president.
now.
Everything is coming down. Inflation is coming down. The cost of groceries is coming down. Fuel, housing, etc. And sir, today, in the last 2 weeks, you will go down in history as the greatest president for the health of this country in history. Think about our new dietary guidelines from Bobby Kennedy and I, but with your leadership, putting real food back in the middle of our health care conversation. Whole milk for healthy kids with those dairy farmers 2 days ago. We were in Pennsylvania talking about it yesterday. And today, putting the patient and the doctor back in charge of health care with great leaders like Governor Pillen.
All right.
God bless you,
Thank
your
you very
leadership,
much.
and all of our leaders. Thank you so much, sir.
Thank you very much. It's been a great day. And Terry and Andrew, thank you. Thank you very much for being here. I hear you're just outstanding people
Yeah.
and have really helped. We appreciate it. You want to say something?
Thank you, President Trump, and I would just echo everything that's been said here. Thank you very much for what you're doing. I'm from the northwest corner of New Mexico. We also work with the Navajo Nation.
Right.
And so we have a lot of rural areas in our state and in our county. I'm also a county commissioner. So
Good.
I take as being a nurse practitioner, a county commissioner, with a heavy weight in order to see this happen. And it will help produce accessibility, which is a huge thing. People have to drive for miles in order to see a health care provider, workforce, quality care, and sustainability for our hospitals. That's what we're looking at. We meet next week in Santa Fe with our legislators. And so that is, we're going to be addressing the licensure compact as well.
And they've got to clean up their elections in New Mexico
We're working.
because those elections are so corrupt. It's incredible. If they
Okay.
clean it up, we win by a lot, but they are really corrupt elections. So I think if you want to do this, you have to tell them to start working on that. It's unbelievably one of the more corrupt states in terms of that. But you uncorrupted, so I appreciate you being
Well,
here.
the
Terry.
Northwest corner loves you.
I know. I know.
Thank you.
I know we have great love in New Mexico, but it's the elections are so corrupt. Not much you can do about it. We have that with numerous states. Thank you very much, Andrew. Thank you very much. You have anything to say?
Mr. President, thank you for having me here today. It's an honor to be here to represent the community. I'm from Northwest Georgia. Grew up in West Virginia. To represent my colleagues and my profession, it's truly an honor. This is so important to our patients, to put the physician and the patient back together and take everything else out of the middle. I practice in cardiology. Having efficient, effective, high-quality care is so important, and time is of the essence, and patients need to be able to have close proximity to their doctors to get the care that they deserve. Quality of care shouldn't matter about the zip code. We should be able to do what we are best at and take care of our patients on an equal playing field, and this certainly helps that. I greatly appreciate all that you've done for the American people. You are an inspiration to us. You make us believe no problem is too big to solve. I mean, you are a representative of that. And I thank you for your leadership. Thank you for this opportunity to be here. And thank you for putting healthcare at the forefront. It's so important to every patient and every family that we take care of.
Thank you very much, Andrew. Great job. Great job you both do. Amazing. I've heard unbelievable things. And doctors in particular, thank you very much for being here. We very much appreciate it. Thank you, everybody. It's a big story. Thank you.
Hey, what's up, Chad? I appreciate y'all for rocking with me, man. I hope this puts something on your mind. And if you already, understand all this, share the video about health and what's going on. But the main thing is, guys, we got to exercise more. We got to drink and eat less sugar. We got to eat less processed food. In other words, we got to stop, cut down on drinking all the sugar. We got to exercise more. If it ain't nothing but walking, like what I'm about to go do right now. I was going to skip. See, the way the mind works, guys, the mind was trying to tell me not to go to the gym. But as I'm listening to this about health and certain things like that, it made me say, no, you got to go to the gym. So that's what I'm about to do right now, guys. I got to do chest and back. Make sure you subscribe to the channel. Hit the notification bells. I appreciate all 50 of y'all for being in the building. And if you don't know, I do go live while I'm at the gym. So if you want to come rock with me, give me some pointers or whatever the case may be, come rock with me and come enjoy the live at the gym. I'm about to go to the gym and I'm going to go live from there, because one thing I love about the gym and going live, I can look at my technique and I can look at my movements while I'm looking inside of the camera, which is the live. So I think I'm ending right here, guys. I appreciate y'all for rocking with me. Everybody that tuned in, I love and I appreciate y'all. I hope this puts something on your mind. You know what I'm saying? No matter if you hate Trump, like Trump, or whatever case may be, focus on the meat and potatoes. That's what we need to focus on, the meat and potatoes. So with that being said, I love and I appreciate y'all. I will be going live when I get to the gym. Hope you come and join me. Come through. Leave me a tip. Make fun of how I do the workouts, whatever the case may be. It's all fun. It's all, it's all fun and it's all love. So I love and I appreciate y'all, chat. Appreciate everybody that's been subscribing to the channel. I appreciate everybody that's been coming through. I appreciate y'all, because I wouldn't be able to do none of this if it wasn't for y'all. And that is to try to help as many people as I can. And the people can help me too, because it's a two-way street. Even though I'm the one talking and showing, a lot of people help me in the comment section. And I love and I appreciate y'all. Over here, it's freedom of speech with no emotion. You know what I'm saying? As long as you ain't threatening kids, as long as you ain't downing no kids, as long as you ain't threatening nobody, you got the freedom of speech, because that's what we vote for as Americans. We vote for the freedom of speech, and we vote for the right to bear arms and everything else, et cetera, et cetera, et cetera. So I love and I appreciate y'all, chat. Earn, spend less, make proper investments, teach it to your kids and your grandkids and the people in your circle. And then after you do that, you teach it to the rest of the world. And yes, your health is an investment. I love and I appreciate y'all, chat. Hope y'all come join me at the gym. The one and only Stock Sniper. I'm out. I love y'all, chat.